Just a brief overview of the MEDTAPP program. MEDTAPP stands for Medicaid Technical Assistance and Policy Program. The program provides funding for activities that contribute to the efficient and effective administration of the Medicaid program. Basically how it works is that Ohio Medicaid will request assistance in a specific area, and faculty and staff that reply or respond to that request are eligible then for federal financial kind of MEDTAPP dollars, MEDTAPP funding to support that work. We have a couple current projects under this MEDTAPP umbrella. One of the maybe most well known is the Ohio Family Health Survey, which is a 5-year project to benchmark, identify, and model changes related to Medicaid and healthcare reform. We have been collecting surveys these are telephone surveys of Ohioans over 3 time periods. We just completed the 2010 survey, and we have planned another administration for 2012. And the project is funded by, as you can see, Job and Family Services, the Department of Insurance, the Departments of Health, Mental Health, the Health Foundation of Greater Cincinnati, Cleveland State University, and Ohio State University. And we have faculty from a number of universities around the state that you can see listed on this slide, who are all participating by conducting research with the data from that data set. And they are receiving funding through the MEDTAPP program to support that work. Another kind of large area of work currently under this MEDTAPP umbrella is the Beacon initiative. Beacon includes a number of children's health quality improvement initiatives. This initiative is using quality improvement science to transform the delivery of health care to children around the state. There are currently in 2011 projects focusing on perinatal care, developmental screening and treatment, patient safety, and obesity, and we have over 900 pediatric practices and 24 hospitals engaged in this quality improvement work around these issues. And there are some more new practices that are going to be coming on board next year. We have funding for this project through Job and Family Services and the Department of Health and our provider partners. And you can see different universities around the state who are all acting as kind of content experts to help deliver the quality improvement science and content expertise to support this work. This slide depicts how the financial reporting and flow of funds works for MEDTAPP. Basically, universities that contract through GRC to provide services to Ohio Medicaid will work with GRC and the Board of Regents. GRC and the Board of Regents incur the costs of those projects and submit claims on behalf of the universities to the Medicaid agency. Medicaid then prepares claims for administrative federal financial participation and submits those to CMS. CMS then will review the claims and process those claims and send payments back to the Medicaid agency. Medicaid then passes those funds through to the Board of Regents and GRC, and we receive payment for the costs that we've incurred on the project. This, the financing, basically the funding through MEDTAPP can be used to pay for direct costs of projects and activities that are occurring at the academic medical centers and universities. They can also be used to cover the indirect costs associated with that work. One requirement is that MEDTAPP funds need to be matched by some non-federal source of funding. And those non-federal sources of funds can come from a variety of sources. One is state agency appropriations. If there are other state departments, for instance, health that wants to put state dollars towards a project, that can be used then to draw down federal financial participation through MEDTAPP. There can be university appropriations. There can be, for instance, university funds or in-kind faculty time that can be put forth. There can be non-federal grants and allowable donations, such as private foundation funds that can also be used to make up the non-federal share. And this MEDTAPP funding can be used to support both existing and new programs and activities. So existing programs that can contribute to the efficient and effective administration of the Medicaid program that meets Medicaid's priorities can be expanded or developed further through MEDTAPP funds. This is kind of a very brief financial model explaining how the funding works. On the kind of left-hand column, you can see for a project with direct costs of $1,000, most academic medical centers have an indirect facilities and administration cost rate negotiated with Health and Human Services that's around 50%. Some are a little higher, some are a little lower. And that means that the overall total cost of a project would be, in this example, $1,500. Half of that can come from federal Medicaid, and half of that has to be matched with non-federal sources of funding. However, if you look over in the right-hand column, you can see that there is a small, I guess, advantage to colleges and universities through the unrecovered F&A. Basically, universities that participate in this program are allowed an indirect cost rate in Ohio through Ohio Medicaid of 10%, but that difference between the Health and Human Service indirect cost rate of approximately 50% and the 10% cost rate that we allow in Ohio can be applied as some of that non-federal match, which can then overall reduce the amount of non-federal match that's required to pull down those federal funds. Okay, I'm going to, at this point, turn over the mic to Mina Chang to talk to you about Medicaid's current priorities.